Good afternoon, everyone. Thanks for joining us today, joining the National African American Tobacco Prevention Network as we host promising practices for tobacco prevention and control in African American communities. This will be a webinar and live panel discussion. The National African American Tobacco Prevention Network, or NAATPN, we are a national organization dedicated to facilitating the development and implementation of comprehensive and community competent tobacco control programs to benefit communities and people of African descent. NAATPN is one of 6 CDC-funded national networks that engages national and statewide partners by providing technical assistance in tobacco control and prevention activities. The purpose of this meeting today, we are going to discuss and review some outcomes impacting tobacco control and prevention in African American communities. We're going to talk about some promising practices and community competent initiatives that are currently taking place. We're going to look at opportunities for action that could impact African American communities, and we're going to begin a dialogue on how we prioritize these opportunities for action.
The actual smoking rates, at least in California, may actually be as high as Dr. Gardner referred to, 32%.
So on this, we have a responsibility then, as a national organization, I guess, as NAATPN, as our partners around the table and the other organizations that we're representing, just to make sure that this is happening, that tobacco cessation for African Americans is included in this Affordable Care Act. And so this is not a matter of, I guess, us hoping that it is. There are some steps that we might have to take.
We do need to be very proactive about making this happen, because if it's not us making it happen, unless it's part of our partners or people who are listening in, it's not going to happen. Yeah.
Valerie's right, unless we do something. I think what people are being asked to, health providers need to be made aware that this is available to them so that when a smoker comes into their office, they can offer them this cessation service free of charge that is covered by this. Dr. Yerga and I were on a conference call last week where this was discussed in some detail. It was an eye-opener to us that local clinics, emergency rooms, outpatient clinics, all of these people then have the ability to do that. Now, what can national organizations do or other organizations do? Is there a poster campaign? Is it, I don't know. Jesse, go for it.
Yeah, I want to even go a step further. This is an opportunity. It's not just a single campaign. It is an opportunity for all of us at this point in time to use the Affordable Care Act to inform the health delivery community in every state and community. And that can be done even by such things as webinars, and local organizations and local groups can take the responsibility of doing the education process on the deliverables that will help smoking aids be utilized in the African American community. This is our time to be able to use the act to bring healthier outcomes in our communities.
And in terms of making sure that these health providers are aware, is it not also a great time and an opportunity for us to make sure that they have and they know and aware of Pathways to Freedom, if this is the only guide that's out there now, or the DVD, Pathways to Freedom, making sure that they have access to it? Well,
absolutely. I mean, there are a number of aids, but those that are community competent that we know about include Pathways to Freedom, and even people can get access to a secondhand smoke booklet called Breathe Free that NAATPN will have available for folks. So there are a number of these things that we can do, and as NAATPN gathers the information, it can make it available to local organizations who want to provide this information to their health delivery system in their own state and own communities.
Okay. Yeah, and I just want to add that not only does NAATPN, but we, at the national level, but in California, we have the African American Tobacco Control Leadership Council. It's time for us to come up with a game plan to see how we can tap into this infrastructure so that people who need these services will have access to it. I know in California, in Alameda County, their medical system is tracking smokers. So I'm sure there are other medical systems that are out there that are making sure that they try to account for all their smokers. The thing is now, what services can they provide? What can they do? How can they help these smokers along their journey of cessation?